Hey, good morning, everyone. My name is Amber Hartchuk. I work in the Oregon Department of Human Services Self-Sufficiency Programs, and I'm the lead of our domestic violence programs, which we are excited to go over with you today. One of my co-presenters that is unable to join us today is Brittany Zitzelberger. She is also one of our policy analysts with all of our domestic violence programs. Both of our contact information, as well as our team, the TADVS policy team, which we'll talk about that, is on this front page. So if you have any questions or follow-up, please feel free to reach out to us. I do have my camera on for this moment, but it is showing me in a separate screen and it's very distracting. So I'm going to turn it off after our next slide, but I do think it's important so you can have a face to the voice that's talking with you. So good morning, everyone. Thank you so much for being here to talk about these programs. They're very near and dear to our hearts, and so we appreciate your time and energy this morning. We also want to just give a reminder that we will be talking about domestic violence and about our programs that we're offering. And it can be a heavy topic and it affects many of us personally. So we do want to recognize that you take some time to take care of yourself. It's okay if you need to take a break to step out of the conversation. We hope that we're able to come together in a respectful environment today and challenge ourselves to learn together throughout these conversations. And so we appreciate you being here. We do also have the National Domestic Violence Hotline on the screen, and so I'll leave that there for a moment so you can see the phone number. That's also a text line, and you can chat online at thehotline.org in case anything comes up and you wanted to reach out for additional support or resources today, or anytime. They're 24/7. Okay, and I'm going to dive into our agenda here, and I'm going to turn my camera off. And just adjusting a few settings. Okay, so today we really want to talk about understanding domestic violence. We're going to talk about some safety indicators and how you can address those. And then we'll also go over our domestic violence programs, which is temporary assistance for domestic violence survivors. That's that TADVS, big acronym, as well as our co-located domestic violence advocate program. We'll talk about some programs that APD has for domestic violence, and then we'll give you lots of resources. And I believe you're getting copies of this PowerPoint following this training as well, which has training notes and links, and so you'll have all of these resources handy. So first, understanding domestic violence and addressing safety. This definition is from the National Coalition Against Domestic Violence. The self-sufficiency definition that we use is different, and we'll go over that in a few slides. But it's important to understand what domestic violence is, to understand how we can address some safety concerns and recognize them. So over the next couple of slides, we'll share how you can start to address safety concerns, where you might see those, and then what resources the application can refer survivors to, and what other resources there are for you and for survivors. And so we do remind that domestic violence, we bolded a few of the words, as a willful intimidation of a systematic pattern of power or control. So we just want to emphasize that domestic violence is a pattern of someone exerting power and control over another person. And so we will talk about this as we go through. And we're going to talk about the safety indicators on the application. So as you can see, we have a couple screenshots on here for you. There's a couple different ways that you might see someone addressing domestic violence or addressing safety concerns. So the first one we have is the DHS 415F, which is the application for Oregon Health, or the application for services, excuse me. And it has questions 5 and 6, which you see on that screenshot there, that are ask those questions very clearly. If you need to get away from an unsafe situation, or does your partner make you feel afraid, this is a spot that you might see some safety concerns. On the application for the Oregon Health Plan, or the OHP 7210, that's that second screenshot you see there, also asks those same 2 questions. And then in the One System, which is our new system for benefits, we have these questions that you can see on the bottom as well that will come up, and they'll be labeled as safety questions. These questions offer staff the ability to connect with individuals who might be experiencing domestic violence or other hardships to offer support and resources. These don't have an impact for eligibility for non-TADVS programs. So these are safety questions for us to check in. They do not impact eligibility for if someone completes them. Anytime these questions are marked blank, I don't know, or yes, staff are still going to reach out to that person to offer some more support and resources. And these questions are not a request for TADBS, and we'll talk about what that means in a little bit. This is really just a place for us to talk with survivors or anyone experiencing some hardship and see what resources we might be able to offer. This also doesn't change any of our processing timeframes, so if people are concerned about how this might impact their eligibility or processing, this will not impact that. It just helps us to be able to address their safety. And so addressing safety, here's some tips and tricks when you're seeing these as well, or maybe you're helping fill out applications and this comes up. We do want to say that addressing safety for domestic violence requires a lot of training. Today, we're going to give some resources in how you can have a conversation, how you can open up that conversation and talk with people about support. But this training is not a robust training to teach all of the ins and outs of domestic violence safety planning or addressing domestic violence. We do want to give the reminder that it can be harmful if we want to safety plan with someone if we haven't had appropriate training. And so really utilizing the resources in order to give somebody the best support. And so remember that survivors are going to need more than one support as well. So when we're offering resources, it's wonderful if you might be a resource for someone for them to check in, but it's also wonderful if they have multiple places to go to. Things like the national hotline that we showed on that second slide, that's a 24-hour hotline that someone has available as a resource to call. We always want to remind that we allow our advocates, our domestic violence and sexual assault advocates, to safety plan. We'll talk a lot about their role throughout this PowerPoint as well. And just that the advocates are trained, they're experts in domestic violence. And so this is what they do and what they're able to offer and help. So we really want to encourage that we explore the use of advocates and resources with survivors. And the reminder that they are the expert on their own situation. So survivors know their safety, they know their abuser, and they also know what resources might or might not be helpful for them. So when you're offering resources, it's best to work with them and trust what information they're sharing. We know that sometimes when we know how it might feel to help someone in an unsafe situation, and that we might want to give some additional context and information, but it is really best for survivors to make their decisions on what's best for their safety. So here's a couple ways that you might be able to establish safety and support a domestic violence survivor. So that top bullet, establish safety. Before you want to talk about safety concerns or talk about those questions you saw in the application, we really want to assess the situation. We want to see if it's safe to talk first. So we don't want to talk about domestic violence in a public location. So if you're in a spot where other people can hear, that's not a safe place to have that conversation. We never know in the community who they may know or who might be able to overhear that. And then we want to talk with them and ask questions to establish safety. Something like, is now a safe time to talk? Or I noticed you marked some concerns on your application. Would it be okay if we talked about those? And if you're talking over the phone, potentially, you could say, if you're safe to talk, please push one of the buttons on your phone. And once I'll hear this, it'll tell me that you're safe to proceed, and then wait for their response. And then you can also share, for example, if at any time you become unsafe in this conversation, just press a button again, and I will know that you're no longer safe to discuss the topic we're talking about. We always encourage that you explain your role. And this is really helpful to let them know what your role, your process, and what they can expect from you. Express that individuals don't have to share all of the information about their situation. You just want to help get them connected to the right resources and programs that might be able to support them. It's really trauma-informed to explain to survivors what your role is and what your role is in supporting them. Knowing that you have resources and information that they can connect to, and knowing that your role is going to be able to help them, but you might not be the person that they have to share all of their details with about their situation. This could be helpful for survivors to avoid the trauma of retelling their experience over again. It also empowers survivors to make decisions, and we want to encourage to empower survivors to make decisions. So give them options and let them choose what's safest, what information is best for them. If they want to call the office or connect to apply for TADBS, or if they want to connect with an advocate on their own, or reach the national hotline, really letting them have the resources and information so they can make that choice for themselves. And then we always believe survivors. We always inform them that we are here to help and to support, but they're the ones that are in their situation, and we understand, or we cannot understand what they're experiencing. they're going to have to make the decisions that's best for them, and they need to make those decisions in the moment. And so for us, remembering and recognizing that we believe survivors, that they might make decisions that we want to believe and support, because they're choosing for their safety, potentially their children's safety and others as well. So using phrases like, I believe you deserve to be safe, you did what you had to do to keep you and your family safe, are good things to phrase and to say to survivors so they know that you're supportive. And then always using a calming tone, being supportive, and be realistic and informative at the same time. So remain calm. Your tone and your calmness is going to really help to slow down the trauma brain and give someone who might be having a trauma response a sense of security, as well as being realistic and informative. So giving a real, like we talked about, explaining your role, letting survivors know what they can expect, being realistic about timeframes, giving them information, concrete information and resources. And then provide resources and offer options like TADVS, which we're going to talk about, your advocates, again, the hotline, and then reminding that to tell survivors what they can expect and what timelines they might be able to expect. So if there's any timelines that we're giving, that they have those with them as well. And there are times that you might have the abusive party present with you during your conversations. So a couple reminders if that happens. Don't address domestic violence or safety concerns if you don't think it's safe to do so. So if you think that the abusive partner is in the appointment with you, it's probably not safe to ask about domestic violence. So maybe you could set up an appointment to get with the survivor one-on-one. Let the survivor lead the conversation. So ask if there's anything else. So maybe you have the whole conversation, you say, is there anything else that you wanted to talk about today? Let them decide, engage if it's safe to bring that up for them. And then also let them know that if they have any questions on their application or any questions, that they can call back and give them that information, that how they can reach out again and where they can reach out. Sometimes, especially if we are experiencing trauma or if something comes up, we forget a lot of that information. So knowing how they can get it again is really helpful. And then we also encourage that you could give a standard list of resources at every interaction. This is really every interaction that you're having, not necessarily every interaction that we think there's domestic violence, because that could be a safety concern too. So if you just have resources that you give, you could provide that list. We do have in this PowerPoint and in the notes that you'll see a list of some resources that we suggest, including the National Domestic Violence Hotline, the National Suicide Prevention, the Safe and Strong Helpline, the Crisis Text Line, and the Aging and Disability Resource Connection are all some really great resources as generic to give. So we're going to talk now about some domestic violence, SSP domestic violence programs, which is the Temporary Assistance for Domestic Violence Survivors and the Co-Located DV Advocate Program. I know we don't have a slide here for questions, but I do want to pause and see if there were any, because that was a lot of info. Do we have any questions, Jessica?
We don't currently.
Perfect. I'll pause here for just a minute in case anyone has one.
Let's see, we just got something into the question box. I'll just read it out loud. One response I sometimes get in response to the safety questions is discomfort providing any affirmative answers to the government for fear of getting their partner in trouble, particularly the partners in law enforcement. In what ways can the answers on the application be used, and who outside of ODHS can potentially access that information? Answers on that front would help us reassure clients who might otherwise decide not to complete the application for benefits.
Thank you for that question. That's a great question. So if someone is hesitant, we do have, well, that's a big question. Let me share a few things. So first, information and access to our system is limited and secured. And so unless you are working for our agency, you shouldn't have access. In addition, our domestic violence cases, if we were to open one, are completely secured even further, where our partners wouldn't have access either. And so if there's a concern that someone's not wanting to fill out that question or they're hesitant, they don't indicate the abuser on the application. So if it's just, I'm not sure I want to name them right now, but I would like someone to ask me about this, you could encourage that they don't have to, the name is not required on the application, so they don't have to call out who it is, what the concern is. Or we could talk to them if they're not comfortable, and I completely understand not knowing who might see that application. our applications go in to a queue and they're worked across the state. And so there are a lot of, we have a lot of employees. And so there's different people. We all have strict confidentiality and we're screening for safety. So if they're concerned maybe that their abusive party would have access because they work for the agency, let them know that they can we'll talk about how they can apply for these programs and if they want to talk further and how they can get that access. So there's different options for how they can do that. So they could mark those questions as a no and then talk about it, or they could even say, you could say just leave those blank and during your appointment someone will ask you about them, and that's a way for them to be able to share that information as well. It's a really great question. Does that help answer that question?
I think there's a follow-up one from another community partner, which is, if there is a potential abuser in the room, do we not even ask the question, or should we still ask the question? Those two questions on the application.
I would ask them because they're on the application. If you are really but I wouldn't dive in and, if someone says no, just move on. And if you are really, really concerned about their safety, that this, like even asking this question, you all work with people a lot. And if you can feel that that might be a harm, I would skip it. But you can still ask the question if someone's in the room. It's also good for them to hear, if the abusive party is there, that this is a question on the application that everyone's being asked. It's similar, I like to compare often to when you go to a doctor's office. There's a lot of doctor's offices that will post signs and say, we meet with the patient one-on-one for the first 10 minutes of the appointment, or whatever that is. A lot of that is to check in on safety so that they're able to talk one-on-one. It's just a policy. We do this for everyone. Every patient we meet for the first 10 minutes. So it helps to see that every application is going to have those questions and that they're going to be asked those questions. It's not something we're calling out and trying to ask only this person.
Thank you so much. And folks, feel free to continue to put things into the question box and we'll have more opportunity to pause and answer.
Perfect. Thank you, Jessica. And thank you for the questions. So we're going to dive into some resources and what you can expect. So what is TADVS? That big long acronym. It's Temporary Assistance for Domestic Violence Survivors, which is why I'll say TADVS quite often. This is a TANF-funded program. TANF is Temporary Assistance for Needy Families, which is cash assistance. It's intended to provide temporary financial assistance and support to families affected by domestic violence. Because we're TANF-funded, there is a requirement to have children to be eligible for the program. This program is used to address safety concerns relating to domestic violence. And we see this most often utilized when survivors are fleeing or when they have fled and they're trying to stabilize their living situation. So here's some eligibility factors that we're going to talk about. This is an overview of eligibility and very brief. It's on one slide. And so it can't possibly capture all of the situations that may or may not make someone eligible. So it's important not to tell someone if you think they're eligible or not, but instead to just provide TADVS as an option. As I mentioned before, TADVS is a TANF-funded program, which means we have to follow a lot of the TANF eligibility requirements. But there is a lot of flexibility in those. So the first is that you do have to have a caretaker, relative, and dependent child relationship. Since TANF is a federal program, that requirement follows us as well. We also follow the TANF income limits, but we give a lot of deductions. So TADVS first looks at your net income and then any deductions in addition. And we give a lot of deductions. So things that you may have already paid or are going to pay. So I will use myself as an example. I work for the state of Oregon. I get paid on the 1st of every month. And when I look at my paycheck, I think, wow, I have all this money. And then all my bills come out and I think, wow, look at this now. All of those bills coming out of that money is counted. So all of the income that we're already expected to pay, the bills that are already obligated, the costs that we have within the month are taken out. And then any money that's being saved for their domestic violence situation. So let's say I pay all my bills and I have $300 left for the month. And I say I'm saving that $300 for a security deposit for a new place for my safety concern. Anything that you're saving for safety is not counted. and anything that the survivor might not have access to. So if I have a shared account with my abusive party, a shared bank account, and it would cause a safety concern for me to pull that money is not counted either. So it's really hard to be over income for the program. And we share that so that people don't have concern about applying. They do have to have a current or future risk of domestic violence, of a domestic violence safety concern. And so really having that risk in that situation that they're experiencing. And then they have to meet the self-sufficiency definition of domestic violence, which I will show you on the next screen. And so the self-sufficiency definition is here with the occurrence of one of the more of 1 through 4 between family members, intimate partners, or household members. We like to share that relationship criteria expands beyond intimate partner violence and that first definition that we looked at. So our definition really is going to encompass current or past partners, current or past family, well, hopefully still current family members, or current or past household members. This is determined by Oregon state law, and so this is in statute. I just give a pause so you can take a look at that. Okay, so now that you know a little bit about the eligibility, how does this program even work? So to apply, the survivor has to complete the 415F application for benefits. You cannot apply for temporary assistance for domestic violence survivors in one. That's because it's a safety concern. If you were able to apply there, it would show on applicant portal, and we don't want that tracking. And so you do have to call. We do want to point out that there's no authorized representatives in the TADBS program, so survivors themselves will have to complete and apply for the intake. That's for their safety and confidentiality. However, they can have a support person calling with them, so that if they do need an authorized representative or someone to help, they can absolutely have them calling. Once they're eligible, TADBS is a 90-day eligibility period. There's no extensions, but they can reapply. And then once they're eligible, they'll create a safety plan with the Oregon Department of Human Services Self-Sufficiency. That's done with family coaches and self-sufficiency. And they'll determine resources, help connect them to advocates, and then plan how they best want to utilize their funds. Once they're eligible, they get up to $1,200 to support their safety plan. So that's a grant that they're able to access. And they can request payments that align with their safety plan. And those safety plans can change all the time because safety situations change all the time. So that way they're able to utilize that $1,200. And what that looks like when they're trying to make payments, survivors will request payments for their needs. So they'll say, hey, I contact their family coach at the office and say, I found a place that I'd like to move in. Payments are going to align with their safety plan. So usually we'd have a safety plan that talked about how moving is potentially a good option, and I would like to move to a different city potentially. So we can also change that safety plan at any point in time. All of the payments that they're requesting have to be, in order to be approved, have to be related to their domestic violence safety situation. So sometimes people will ask for payments that are, maybe just some gas money to get around town. And if it's not related to safety, it wouldn't be eligible. So making sure that it's related to that safety. We do verify all payments. So the payment requests, for example, a landlord, we will confirm either through a rental agreement or contacting the landlord that they actually own the home and are able to rent it out. This is an additional safety piece for survivors. As you can imagine, for example, there's been a lot of housing scams. And so us double checking and verifying that there's a legal ability to rent that location helps to protect survivors from spending that grant on something that might potentially be a scam. And then payments are often made to vendors or dual payees. So because again, we're paying for things like relocation costs, U-Hauls, and we'll talk about example payments on the next page. They are actually paid directly to the vendor or a dual payee. And some payments that you might see, again, are most often used when individuals are fleeing, but we pay a lot of things. Housing is a big one. Housing is security deposit, first month's rent, all of that for moving costs. Relocation costs, which is everything, including U-Haul, gas, train, a bus. If they're leaving town, if they're leaving the state, we can pay for plane. Plane, we do have a contracted agency that we work through. Emergency shelter or motel, we're paying for somewhere for them to stay that's a safe place. replacement of vital records or lost essential items. Sometimes people have to flee without any of their materials, and so that is also something that we can pay for. So how do you apply for TADVS? There's a couple different ways. Again, there's no authorized representatives, and so please let them know that they'll have to apply on their own. But we can still, you can help aid in getting the application there or helping them to connect. So they can apply in person at any ODHS office. They can request the 415F application. The application for services, it can be requested at the front desk. They'll complete and submit to a receptionist for a timely appointment, and then they'll be seen within 16 business hours of completing the application. Most often, that 16 hours is on the earlier end of that, and a lot of times they're seen immediately when they turn in an application. If the survivor applies at a non-self-sufficiency storefront office, that's the storefront offices are where we're able to do the intakes and the appointments for TADVS, and so they'll be connected to their local office for that appointment. You can also download the application online and submit to any self-sufficiency office as well. And again, that form is 415F. It's a fillable PDF. It can be printed and filled out in large print English, Russian, Somali, Spanish, Vietnamese, Arabic, and Burmese. And they can also turn it in by person, mail, email, fax, any way. They can also call any ODHS office or self-sufficiency office and apply over the phone. That includes requesting for the program and completing the entire application can be done over the phone. Or they can complete an online application, which we mentioned the one system does not have TADVS. So they could say apply for SNAP, and then during their SNAP appointment could say, I would like to apply for TADVS. And so that way they're able to ask in many different ways. So that question earlier, maybe I don't want to answer the safety questions, maybe they leave them blank, and during their SNAP and TANF interview, they say, I want to talk about those, and I've heard about this TADVS program, I'd like to apply. And just a reminder that TADVS is determined by family coaches at self-sufficiency offices. So they can survivors can apply anywhere, but it might be the most streamlined process for them to go directly to a self-sufficiency office. We also like to talk about our utilization. We want to continue to message to survivors about the program. It's a hard thing to kind of share that information. So if you're seeing somebody that has anything going on or they're talking to you about safety concerns and you want to offer this program, please do. We hope that you help to share us about the program. Some quick facts in the last, well, now almost, well, that's a long time ago now, July 2019 to June 2020, we had a total of 5,784 families that applied for TADVS and were eligible. Out of that, a total of 3,608 used at least a portion of their $1,200 grant. That's because not always do people utilize the payments during that eligibility period. Maybe they're looking for housing and they didn't find it. But that approximate average per case was $982 spent out of that $1,200 amount. So I'm going to see if there's any questions about the TADVS program.
Yes, and we do have one, which is if someone doesn't have an immigration status, can they apply for this?
Great question. Yes. So when we talked about waivers, and there's a lot that we can waive citizenship status. So you can have any eligibility or any status of papers, no papers, citizen, non-citizen, refugee, any status, and you're able to apply. We can waive that for everyone in the filing group. So that includes the adults and children.
Thank you. Does this apply across all of Oregon?
Yes, absolutely.
Can a single person apply?
They can apply, but a single individual is not eligible unless pregnant, and they're eligible within any month of that pregnancy. So if they are a single person, we do encourage still that they apply. Sometimes single people will apply and their kids are out of the home because of the domestic violence situation, and they're still eligible. They also get safety planning regardless as part of this eligibility process. So if they're eligible for the financial grant or not, they're still going to receive safety planning. So you do have to have children in order to receive the grant, but we encourage everyone to apply if they're interested and if this is a resource that might help them.
Thank you.
Thank you.
Looks like those are the questions for now.
Okay, perfect. Let's go on to some more good stuff. Collaboration with our local domestic violence and sexual assault agencies. We have a program called the ODHS Co-Located Domestic Violence Advocates Program. And we're going to talk about that. So what is a co-located advocate, you might be asking? Well, they are from our local nonprofit domestic violence sexual assault agencies, which there is one in every county in Oregon. And they are able to provide confidential advocacy services to ODHS clients. When I say confidential, we mean super confidential. They have advocate privilege. So advocate privilege means that all of our advocates in the state of Oregon are certified advocates through this program in the state, are not mandatory reporters. Their privilege means that they can't be subpoenaed to testify in court, and that they are not mandatory reporters at all. And we're going to explain this more in later slides. They are also not state employees. So I know that there was that piece of, I'm not sure I want to tell the state about this information. Our co-located advocates sit in our offices right now. They're virtually sitting in our offices, but they provide services but are not state employees. Anything that is shared to that advocate is completely confidential and not shared with us unless the survivor signs a written release to do so. And so that is a great place if they have questions and want to touch base to talk to them. And then this provides the survivor a connection to the advocate, but also their entire organization. So domestic violence, sexual assault organizations are much more robust. They have a lot of domestic violence services. That's what they do. It's their expertise. And so by connecting them to the advocate, you get that entire safety planning, you get all of those resources, as well as everything else that they offer, which include, but is not limited to, really in-depth safety planning, talking about their safety, children's safety, what it looks like in the home, out of the home, and the relationship. They do risk and fatality assessment. They offer shelters, so most advocacy agencies have shelter services or connection to shelter services. They support and referrals to other community resources, like a big one is mental health, for example, and a lot of advocacy agencies maybe partner with certain mental health providers that specialize with domestic violence, and so they have that referral process as well. They're confidential advocacy services, and that confidential is huge when we're talking about safety, and I'm sure that you all know that as well. So really having that place that they're not going to have a mandatory report, their information will not be shared, is very helpful. And then they can also help completing restraining orders or protective orders, plus a host of other information. And advocate's really a person that is going to be there for that survivor. And so they have confidentiality and privilege. The federal funding is what gives them their confidentiality. And we've cited a lot of these these federal sources as well, in case you're interested. But their purpose, so for community organizations whose purpose is to provide direct services to survivors of domestic violence or sexual violence, they get federal funding that mandates they cannot share information. It gives them confidentiality. Oregon is super cool, and we gave all of our advocates privilege. And so in addition to first looking at their federal funding, we do want to recognize that these restrictions that they have on information sharing is actually more strict than HIPAA guidelines. And there's only 3 exceptions to when they can share information, which is in a voluntary, informed, written, and time-limited release of information, which we have on the bottom we'll talk about, if there's a statutory mandate or a court mandate. But in Oregon, our advocates have privilege, and that privilege is a state law which says that they by statute cannot be mandated and are not mandatory reporters, and they cannot be court mandated to testify in court either. And so that really gives them protection, where those 2 out of those 3 requirements of information sharing are taken away by advocate privilege, when really the only way to share is if the survivor fills out a release. So advocates will share a release with the survivor if they want to share information. Maybe they're working with someone, and let's say they got a new phone number, and they said, would you mind telling my family coach that I got a new phone number? They're able to do that. They would sign their release. It would be around, it's time limited, so it's around whatever time frame the survivor is requesting. Usually it's about 30 days. It says the specific person information can be shared with, and then the specific information that can be shared, and it can be revoked at any point in time. So if I signed a release for the next 30 days and I called today and said, hey, I don't want this, please remove it, they can remove the release, absolutely. And then these help survivors be safer. This means that they get completely free confidential advocacy services. They're not going to be further victimized because it's traumatizing when your private information gets out. And so their private information will not get out. We hope that this makes them more likely to use advocacy services, and then they're going to benefit. Survivors benefit greatly from advocacy services, and how someone can help support to walk them through what they're experiencing. And so as you can imagine, we want to maintain those relationships with our advocates and with our staff. And so we talk about these advocate privilege a lot in our offices. Our advocates attend our meetings to make sure that they're well versed in how ODHS works and what information they can share. We send them emails and hot topics, and they send us emails and hot topics to keep us informed. They participate in our councils, our work groups, our trainings, any policy decisions we make, our advocates share in that decision, and then they provide their expertise. We also have domestic violence points in all of our offices that work with them. We have a working together guide that explains the advocate role as well as self-sufficiency and child welfare's role, and that's linked in this PowerPoint as well. And then some resources and information. This is these purple box here, that's statistics from our advocates from the last year, and they served over 8,000 new families a year and over 6,000 ongoing. So that means that they served a lot of people, really. They completed 11,000 safety plans. They provided over 40,000 hours of direct service. And they averaged about 1,400 people a month that they were serving across the state. For reference, our TADVS cases are about 1,400 people. So they're serving a lot of folks throughout the state and helping survivors. I'm going to go through these kind of quickly just so that we leave time for questions. But the benefits and self-sufficiency is that those advocates really help us to safety plan and provide that connection. They help survivors figure out how to access the funds as well. And then they do further and more in-depth safety planning than what we're able to do with TADVS. And then they also are in all of our child welfare offices. And so they really help identify domestic violence in cases. They can go out on assessments with child welfare so that the survivor can have a confidential advocate to talk to right when they're getting that first connection and resource. They participate in multidisciplinary team meetings, so really helping us to understand the ins and outs of domestic violence as we're working through cases. And then navigation and support through all of our systems, court appointments, visitations. As you can imagine, it might be really hard to go through a lot of the child welfare processes, and so that advocates can help to support and be a person that is there for survivors. We did do a pilot survey years ago before the program was this robust, and this is from one of the survivors that shared a quote that said, "I was so happy to meet my advocate because I then realized I wasn't alone. In a maze of bureaucracy, I had found a person who understood me, whose position was made just to help me." And we think that really showcases how advocates are a great support. And so we can connect to an advocate in a lot of different ways. They are in all of our self-sufficiency and child welfare offices. So survivors can just ask, I want to talk to a co-located advocate, but we're contracted with all of our domestic violence sexual assault agencies throughout Oregon, and they're in all counties. So you can find an advocate anywhere, and you can connect survivors with an advocate anywhere. We have a link here at the bottom. They also, all of the advocacy agencies on this link here provide confidential advocacy services. They offer crisis lines that are 24/7 so that they can call at any time to get connected with an advocate. And then if you are looking to search someone or search an advocacy agency, we have that link at the bottom of the page there. The Oregon Coalition Against Domestic and Sexual Violence, that's what that link is for, is a statewide group that supports our advocacy agencies. And they have a map that you're able to search by location, by the language that you need an advocate to speak, or by the service type. So for example, if you're looking for shelters in Multnomah for domestic violence, Multnomah County for domestic violence survivors, you'll be able to find that on this map. So you can click it. It's a really great page to bookmark. So I'm going to pause right there in case anyone wants to bookmark it. And again, that's a really great way to connect to the actual advocacy agencies so that they have that crisis line number. They can call them at any point in time and they've got that whole resource available. So are there any questions about our co-located advocacy program?
I don't see any at the moment.
Okay. Got a couple more slides and then we can open it up. And so the next one, if I could figure out where I was clicking, is the OSIP-M, which is another fun acronym that we love, that there's a special needs payment. So for individuals who might not be TADVS eligible, so we talked about the individual maybe doesn't have children, for example, we can consider whether they might be eligible for the Oregon Supplemental Income Program. That's what that stands for. And this is for individuals might qualify for these special needs payments if they meet the requirements of that program. And so it can be payments that help a survivor of domestic violence or abuse find funds for relocation. Special needs items that might not be included are the basics, and so they help with special needs program or items that might not be included in the programs that we have. So things like SNAP or childcare, if they're not included in that, they might be able to be eligible for this. And then applicants will work with their local APD case manager to see if they can be eligible for this program. So if they are not eligible for TADVS, and again, thinking of those people potentially that don't have children and they have found out they're not eligible, they might be able to go through with their APD case manager. APD is Aging in Persons with Disabilities, to see if they could get a special needs payment for their stability and to help them flee that domestic violence situation. And we do have quite a bit of resources on here for survivors, and these are really great resources to have handy and keep near so that you're able to provide them. So the reminder that we do have advocates in all of our child welfare and self-sufficiency offices that they're able to reach out to. We also have the National DV Hotline. Call to Safety is ran out of Multnomah County, but it is a statewide line for domestic and sexual violence. And then we've got some national sexual assault, national human trafficking hotlines. And then again, that link, I can't emphasize enough how great it is to go to the Coalition's webpage and look. And then we also have more information on our domestic violence staff tools page, which will give you the link in this PowerPoint. And then are there any questions about the survivor support or resources that we just talked about, or resources that exist in Oregon?
You must be doing an awesome job because I think folks are digesting and I don't see questions.
Perfect. I thank you. I appreciate that. It must be an awesome job. It's not because it's almost lunch and we're ready. And some resources for you all. Surprise, that Find an Advocate link is right at the top of the page again. I know it doesn't look like there's links, but there are in the notes in the copy that you'll get. Our domestic violence staff tools page, which has a lot of resources for our staff in ways that, and just domestic violence in general, including a domestic violence toolkit, which if you're wanting to learn more about phone safety, trauma, understanding trauma, navigating domestic violence, all of that is included in that toolkit. The You Are Not Alone webpage is a great resource with a lot of different information for domestic violence, sexual violence, financial abuse, suicide prevention, mental health resources, elderly resources. It's a really great page. There's a little widget that translates it into, I think, 12 different languages. And then we also have our benefits and assistance page where you can find a lot of these applications. And then our ODHS domestic violence webpage. The Working Together Guide, which does tell you about the co-located advocate and the roles around domestic violence for self-sufficiency and child welfare. And then our email for my team in case there's any follow-up questions. Which brings me to thank you so very much for all of your time this morning. And we can pause if there's any questions. And again, our contact information is right there on the page in case you want to follow up or share anything. But I will see if there's any questions.
A few questions about getting a copy of these slides, and they'll go up on our group site for you all. I will make sure that happens ASAP, so before tomorrow. And then within a few days, we should have the video also going up.
Wonderful.
Just going to hold it
I'm
open.
guessing, yeah. We really appreciate all of you being here this morning and sharing. I know this is a lot of information, and so being present and hearing this, and then hopefully sharing with when you're working with people. We hope this is a helpful tool, a lot of helpful tools throughout this, throughout your work.
Yeah, I can definitely say that I really found it useful to get more information about the work that you all do. And I did not realize there were these co-located advocates before starting to work with you.
Oh, well, that's great then. I'm glad we can share that information. Yeah, our advocates are awesome. And these programs are really cool. I also will just take a minute to brag that the TADVS program is one of 5 in the country, and none of the other programs are as robust. And our co-located advocate program is the largest in the country. We have 60 advocates co-located, and the next state has about 5. And so we really, these are great resources that are pretty unique to Oregon as well. And so we're excited to share them.
I think that we might be ready to wrap up.
Wonderful. Well, thank you, everyone. Thank you, Jessica.
And thank you so much for coming to our module format and sharing this really excellent information.